So if you're thinking about a trial and you're watching this ACT program, I would say there are a couple of things I'd like you to do. First, talk to your doctor and say, tell me my full options. Raise questions. Be a pain in the neck. That's what the doctor's there for.
The best patients for me are patients who actually want to talk and are actually inquisitive and challenge me in terms of decisions that I advise them about.
Like a lot of patients, I was concerned that a clinical trial would have negative effects on my life, but all my questions were answered very honestly.
Every patient who has a cancer ought to know, number one, what kind of cancer that they have. They need to ask their doctor the stage of their disease and learn about those diseases and learn about how those diseases are treated.
It's very important to be confident in your doctor. I think it's very fair to ask, what do you know about this cancer?
It is my belief that a patient should feel free to ask the doctor, how often do you treat this disease? Or what's your experience been with this particular treatment? I think those are all very fair questions.
Very few patients are even asked about the option for clinical trials.
So I encourage them to ask their physicians, do you offer clinical trials? If so, do you have any clinical trials that I might be a candidate for? And if not, are there clinical trials elsewhere that I might be a candidate for?
A patient should start by asking their doctor, why are you presenting this trial to me? Do you present this trial to all of your patients?
So patients should ask their physician really what is the purpose of the trial. What are we studying? Are we studying 2 medications? Are we studying 2 procedures? Are we looking at the quality of life for a particular type of cancer? Are we trying to improve survival for a particular type of cancer?
But you need to know all the facts about it. What are the potential side effects that are known? What is the potential benefit that's known? And what are we comparing it to? What's the standard of care right now? And then you'll find out whether it's worth it to you to try this.
It's very important that we as physicians explain to the patients what their responsibilities are. Are they going to have to travel for a clinical trial? Are they going to have extra tests? And how it's going to disrupt perhaps their lifestyle. They should also discuss with them, well, what if I don't participate in the trial? What treatment would you give me if I don't participate in the particular trial?
Of course, I had complete faith in the medical team, but I knew as a patient that I had to do my part and make sure that there wasn't any information that was potentially being obscured or omitted. And that combination put me at peace and made me feel very ready to participate in the clinical trial.